Your favorite governor is pushing and has actually succeeded in they're creating basically a state financed uh, version of Narcan for that they use for
Mm,
drug overdoses and all that to
yeah.
reduce the cost. It costs significantly less than the actual brand, and which so again the attention I think is good in terms of trying to reduce costs. But how far do you go down this road and you start doing state sponsored, state owned things?
Mhm.
I don't really know how I feel about it yet, but it's a pretty interesting step to take for a government.
And it's one of these things that's so untested that it's hard to say, oh, this is going to happen or that's going to happen. But before you even look at that particular drug, I would say you got to take a little bit of a step back and sort of look at like sort of like big picture. So I'm a very big proponent and believe very strongly in mental health services. As sort of a libertarian and a conservative, the impulse is always, somebody is down and out, and it's like, well, pull yourself up by your bootstraps, get together. All these other people are out there working. What are you doing? But the thing about mental illness, and I've worked with patients with mental illness as a physical therapist, so I wasn't their, you know, mental illness
Therapist, right?
therapist. And so I can tell you for a fact that some people are so mentally ill that they cannot pull themselves up by their bootstraps. It just isn't
Right.
going to happen, not happening. So that is where state action, whether it be state or federal type state action, we should be helping people. And one aspect to mental illness is drug addiction. And one thing that I'm absolutely against is giving people needles or giving people drugs because then you're just facilitating the drug habit. You're just spending money to keep people addicted to drugs. Terrible idea. Now, I'm perfectly willing to help people get off the drugs and alcohol and say that the state should spend money on doing things like that because I think it's very worthwhile. Because, I mean, the people that are addicted to things,
Yeah.
they can't function. They're addicted to things.
Yep.
And this is where the access to this Narcan type drug that can save people's lives comes in. But the question is, what's the state going to do with it? So for me, if the state says, look, we have this drug, it's pretty cheap. If you want to get off the street, if you want to get off drugs, we can give you assistance, but part of the assistance is you have to, take the drugs that help you get off the addiction, to help you wean off the drugs that you're addicted to. And then when you can demonstrate that you're no longer, involved with drugs and alcohol, that qualifies you on the first step to start moving forward with, helping yourself essentially get back. So now you can qualify for better housing. You can qualify for,
Right.
maybe job assistance or other things. So in a sense, I like the idea that the state could have a battery of drug resources to help the people get off the street and get off the drugs, because I think that would be very worthwhile. But if all you're going to do is give people more drugs, and Narcan in and of itself is in fact a drug,
Yeah.
and so if you're just going to keep giving them these drugs, which they will decide to take at their leisure or won't take or whatever, and you're just going to put it out there, well, I mean, you haven't really accomplished anything. So it just depends on what they do with it. If they have some good, constructive idea about how to start getting people off the street and get them off the drugs, that is fantastic. If they just have this drug that they're going to give out to people for less money, then, it's like, well, that's a waste.